Did you know that nearly 14 million adults in the United States can't recognize even one symptom of a heart attack? Not one. Now imagine this. You're driving home from the grocery store. You're feeling off, maybe a little tired, maybe slightly nauseous, but nothing you'd rush to the ER over. You figure it's just indigestion or maybe stress, so you brush it off. And that one decision, that moment of hesitation, ends your life. The truth is, heart attacks rarely start with the dramatic collapse we see in the movies. No chest clutching, no falling to the ground. Often the signs are silent, subtle, and spread out over days, or even weeks. And yet, because we don't recognize them, because we think it's probably nothing, we risk everything. So today, we're breaking the silence. Because instead of hoping it's nothing, wouldn't you rather know if it's something? She was 47 years old, weighed just 113 pounds, ran 2 miles every morning, ate healthy, no history of heart problems. So when she showed up at the emergency room with shortness of breath and a strange pressure in her back, the doctor looked at her, smiled and said, "You're just anxious." He sent her home without a single test. 6 hours later, she was in cardiac surgery. She'd had a heart attack. One artery was completely blocked. You see, heart disease doesn't care what you weigh. It doesn't care how far you run. And it certainly doesn't care if you look healthy. That's the terrifying part. Because instead of listening to the data, to her symptoms, to her instincts, someone decided she didn't look like a heart attack patient, but her body was telling the truth all along. Are you listening to yours? These signs, these whispers from your body, they don't always show up like thunder. They slip in quietly. One here, one there. A little discomfort, a little fatigue, a little not feeling right. That's what makes them so dangerous, because we don't talk about them. We don't recognize them. And too often, we don't survive them. But today we will talk about them. We're going to walk through 7 of the most common, most misunderstood early signs of a heart attack, so you can see them coming before it's too late. Let's start with the one most people expect, and then quickly move into the ones they never do. Let's walk through the early warning signs of a heart attack, the kind that often show up days, even weeks before something serious happens. They're quiet, sometimes vague, but they matter. Let's start with the first 4. Sign number 1, pressure or tightness in the chest. This isn't always the stabbing pain people expect. More often it feels like something heavy is pressing down. Dull, squeezing, uncomfortable. Some say it feels like an elephant sitting on their chest. One man, 56 years old, healthy weight, no history, thought he had indigestion. Took an antacid, laid down. He never woke up. Later, doctors found a 99% blockage in one of his arteries. This kind of pressure might come and go. But if it's new or doesn't feel right, don't wait it out. Sign number 2, pain in unexpected places, jaw, neck, shoulders, arms. We call it referred pain. The heart sends distress signals, but the pain shows up somewhere else. A woman described it like this: "Both of my arms hurt like they'd been run over." Her doctor said arthritis. Hours later, she was in surgery. 2 stents. Pain in your upper back, between your shoulder blades, even your teeth or lower jaw. These are all real red flags, especially if you can't explain them with a pulled muscle or joint issue. Don't wait for chest pain. It might never come. Sign number 3, unusual fatigue or sluggishness. Your body shouldn't feel like it's shutting down. But when the heart is struggling to pump blood, fatigue shows up first. A woman told us her husband, an avid runner and vegetarian, had seemed tired. Just tired. His eyes looked bloodshot. He came home from work, sat down, and never got back up. If you feel slower, weaker, or more wiped out than usual, and there's no good reason, listen to that. Sign number 4, cold sweats, dizziness, or feeling faint. You're not doing anything strenuous. You're not in a hot room, but you're sweating, lightheaded. Maybe your vision's a little fuzzy. That's not normal. One physical therapist shared how a man walked into their clinic drenched in sweat, breathless. "Do you normally sweat like this?" he asked. "No," the man said. That answer saved his life. He was having a heart attack and didn't know it. When your body sends out cold sweats or dizziness, it's not being dramatic. It's trying to survive. Now let's look at the final three signs. Some of the most commonly missed, especially among older adults and women. Sign number 5, shortness of breath without much activity. If you suddenly can't catch your breath, walking across the room, going upstairs, or just talking on the phone, that's not just age. It's a warning. A woman described feeling winded during simple conversations. Not running, not climbing, just talking. Her doctors discovered a hidden heart condition triggered by anemia. No blocked arteries, but her heart still suffered. If breathing suddenly feels harder than usual, don't write it off as just getting older. Sign 6, nausea, indigestion, or a strange sense of off. This one is tricky. Many heart attack victims, especially women, describe symptoms that sound more like the flu. Nausea, upset stomach, or just not feeling right. A man once searched heart attack symptoms at 3 a.m. while pacing his living room. He had told his wife he had heartburn. She found him collapsed just minutes later. If your gut tells you something is wrong, listen to it, especially if the discomfort doesn't go away with rest, food, or antacids. Sign number 7, pale or ashen skin. When blood flow drops, it shows in your skin. Your face may look gray, lips pale, hands cold. One woman said her 91-year-old mother looked strangely quiet. Her cheeks had gone colorless. Paramedics were called, but it was too late. Skin tone isn't just cosmetic. It's a message from inside. Now here's the truth most people miss. These signs don't usually arrive in a neat, dramatic package. They creep in, one by one. You feel tired, then maybe dizzy. A week later, breathless. Or maybe your arm aches at night. You Google it, feel unsure, and go back to sleep. That's how heart attacks happen without warning, because we miss the pattern. So instead of waiting for pain that knocks you down, watch for signals that build quietly. Your body speaks up. You just have to be willing to listen. Here's something most people don't know. Half of all women who suffer a heart attack never feel chest pain. Not once. Instead, they feel like they're coming down with the flu, or they think it's anxiety, or stress, or a bad night of sleep. And when they finally go to the ER, they're often dismissed, told to rest, to breathe, to relax. Too many don't make it back for a second opinion. So in this next part, let's talk honestly about how heart attacks show up differently in women and why that difference costs lives. Heart disease is the #1 killer of women in the United States. Not breast cancer, not stroke. Heart disease. But here's the problem. Most of what we know about heart attacks, how they look, feel, and progress, was based on decades of research in men. That difference has a name, Yentl syndrome. It describes how women are less likely to be diagnosed, less likely to be believed, and less likely to receive timely treatment, unless they present symptoms that look like a typical male heart attack. But the female body speaks a different language. So what does a heart attack look like in women? It might start with back pain, not just soreness, but a deep ache between the shoulder blades. It might feel like jaw tension or a dull pain in the neck, or like extreme exhaustion. So heavy that you have to sit down just from standing at the sink. Some women describe nausea, others feel dizzy or lightheaded, others say it's anxiety, but without the racing thoughts. Just the physical wave of something being wrong. There might be cold sweats, sleep disruption, a strange sense of impending doom, and sometimes nothing at all, until it's too late. Stories from women say it best. One woman told her doctor she felt like someone had hit her in the back of the head with a bat. She was brushed off, told to see a psychologist. She was having a heart attack. Another woman was told her arm pain was arthritis, but her husband drove her to the ER at 5 a.m. anyway. She had 2 stents placed within 30 minutes. Time and again, women report being dismissed. Not because their symptoms weren't real, but because they weren't textbook. If you're a woman or loved one, here's what matters. Trust your instincts. Know the signs, speak up, and don't let anyone silence your concern. Because heart attacks don't always come with pain in the chest. Sometimes they whisper through fatigue, jaw aches, or a single breath that doesn't feel right. And when you catch them early, you live longer. Now here's the hardest truth of all. Many people don't die because they miss the signs. They die because they saw the signs and were too afraid to call 911. Not afraid of the pain, not afraid of the hospital, afraid of the bill. In America, an ambulance ride can cost over $1,200. That fear keeps thousands of people from getting help. But let me ask you this. If you collapse on the floor, alone, gasping for air, who's going to drive you? Money is replaceable. Your life isn't. We've heard it again and again in the comments. I'd rather die than pay another $4,800 for a 6-minute ambulance ride. My mom begged me not to call 911. She didn't want to leave us with the bill. I walked into the ER with chest pain and nearly had a heart attack from the cost. It's real. The fear is real. And it's heartbreaking. Because when every decision feels like choosing between bankruptcy and survival, people freeze. They delay. They convince themselves they're okay. But here's what you need to know. You can't drive yourself if you pass out at the wheel. You can't argue with the receptionist if you're unconscious in your living room. You can't fight a heart attack with hope. That's why first responders matter. That's why 911 exists. And there are options. In some areas, you can sign up for an annual ambulance subscription, $100 or less per year, and pay a flat rate if you ever need it. Some cities have programs for seniors or veterans. Some hospitals write off emergency care based on income. Yes, the system needs fixing. Yes, the costs are high, but no bill is worth your life. So if you feel something wrong, if your breath is shallow, if your chest is tight, if you're dizzy, pale, or in pain, make the call. Don't hesitate. Don't gamble, because your family would rather fight an insurance company than bury you. It's a question we hear all the time. How do I know if it's just stress or something more? Because the truth is, anxiety, panic attacks, and heart attacks can feel nearly identical in the moment. Tightness in the chest, shortness of breath, cold sweats, dizziness, a racing heart, a sense of doom. Sound familiar? One woman said she went to the ER 5 times in 1 week. Every time they told her it was anxiety. Every time she believed them. On the 6th visit, she went into cardiac arrest. She was 49. Another man said he felt faint, sweaty, and nauseous. He practiced deep breathing, took his anxiety meds, but it didn't help. It was a blocked artery. So how do you tell the difference? The short answer, you can't. Not with certainty, not without tests. And that's why it's dangerous to assume. A panic attack usually fades after 20-30 minutes. A heart attack may build, plateau, or fluctuate, but it doesn't truly go away without intervention. Panic often follows emotional triggers, stressful events, crowded spaces, high-pressure moments. Heart events can come during rest, in sleep, or in the middle of a relaxing afternoon. But the only way to know for sure is through medical testing. An EKG, blood tests for cardiac enzymes, oxygen levels, and possibly imaging. So if you're ever in doubt, don't try to be brave. Don't wait to see if it passes. Here's a rule of thumb. If something feels off, and it's stronger, longer, or different than usual, go in. Your loved ones need you alive, not proud, because every minute counts. And if it turns out to be anxiety, great. You go home and rest. But if it's not, you've just given yourself a fighting chance, and that's something worth showing up for. We've shared the signs, we've told the stories, and maybe right now you're thinking about someone you love, a sister who keeps brushing off her fatigue, a husband who won't see a doctor, a parent who says, "I'm just getting old." This video might be uncomfortable. It might stir up fears you've tucked away. But you know what's worse than fear? Regret. Regret that you didn't speak up. Regret that you didn't forward that one video. Regret that you noticed the signs, but didn't act on them. So here's what we're asking. Share this. Send it to someone who needs to hear it. Talk about it. At dinner, at church, at your next doctor's visit. And if you're the one who's been feeling off lately, stop waiting. Make the call. Get checked. You don't need to wait until it hurts. You don't need to collapse to be taken seriously. You don't need to be brave. You need to be here, because no one else can replace you. And remember, Brad and I can fix just about anything except a broken heart. But if this message reaches you in time, maybe you won't have to find that out. Stay safe, stay aware, and above all, stay alive.